All right, we're moving on. Now we're talking about tachycardia. Now, you know we've already done videos in bradycardia. You know that we talked about telemetry. We've done videos in EKGs and telemetry and the basics of how to read the actual strip. Well, this particular video is moving along. It is tachycardia, and specifically I want to tell you that tachycardia is different from all the other videos because in this situation, the name of this video is actually causes, but the point of the video is the treatment, which is the treatment of the cause. So this will settle both videos, right? This will just kind of be two in a one. So the title of this video, of course, is Tachycardia. What are the causes? Oh, there's lots of causes. And in your mind, when you're looking at tachycardia in your patient, you've got to go through that checklist of your mind of all the things I'm going to talk about right now. You know, that select all, that apply on tachycardia. So let's go. 99 times out of 100, your patient is tachycardic because either they're losing blood or they have no fluid. Blood is a fluid, but it's not always just blood. It could just be just fluid. Now let's look at both of those. Let's look at the fact that I have taught my students that if they get a patient with a heart rate of 110, assume that they're bleeding until you prove they're not. And the reason why I do that is because I want the student to see a heart rate of 110 as a bit of an urgency. It may not be who you see first, but it might be who you see second and third, if you know what I mean. Of course, we need more information to help us nail it as maybe the first person to see. But certainly it's up on the totem pole of who you better be checking out. So if we have a patient with tachycardia, which by definition is a heart rate greater than 100, let's focus on those patients who are really tachycardic and they're 110 and higher. When a patient's heart rate is 110 and higher, like I said, assume they're bleeding because there's so many reasons why you could be bleeding in a hospital. Maybe you just had surgery. Then your suspicion should go way up that the surgical area that was operated on is now bleeding. Now, depending on what kind of operation that is, if it's a C-section, if it's a patient that has had a laparoscopic surgery, if it's a patient whose gallbladder was removed, if it's a patient who had a colonoscopy or any other oscopy, you know, the bleeding could be internal and not real obvious. Or in the case of a C-section, it could be real obvious and the dressing saturated and on and on and on. I had a patient not too long ago and she was being exotically worked up for all these crazy different diseases. And to be honest with you, my hunch, and it turned out to be true, was that this patient is a GYN bleed for reasons that were basically based on her birth control method. So it could be anything. And so you're looking at the age of the patient. You're looking at what did the patient have done while they were in the hospital. You're looking at the risk factors. And can I just tell you a little something about these risk factors? Oh, honey, this is for JP Public too. One of the #1 reasons I see for bleeding in the hospital setting, and remember where I work in a med-surg telemetry type environment. One of the #1 reasons why I see for why a patient might be bleeding is Motrin, ibuprofen, Advil, Aleve. Those are brand names, but suffice it to say that what you want to remember are NSAIDs, non-steroidal anti-inflammatory drugs. So NSAIDs, all capital letters, NSAIDs, non-steroidal anti-inflammatory drugs. Oh honey, people eat those like it's candy. I'm talking about M&Ms. They go to the store because they're over the counter and they believe they need 3, 4, 5 of those pills all at once. They're so confused, they don't know that the dosage of Motrin, ibuprofen, and Advil is completely different from the dose of Aleve, and they just decide to take them all the same kind of way. And then they become the #1 reason for a GI bleed, the fact that they took all these NSAIDs. Yeah, it's more common than you know. It's actually scary how commonly that happens. And so on my television channel, HETV, which is geared towards the public as well as students, I will be talking about those drugs and helping people understand what they don't want to do. Now, back to the lecture at hand, tachycardia. So you get it, right? There could be bleeding from a post-op issue. There could be a GI bleed because this person thought that Motrin was M&Ms. It could be that the patient is just bleeding from some other source because they're an alcoholic. Let's talk about that. We know that once you've determined that the patient is an alcoholic, that you better be watching them for bleeding from an ulcer, bleeding from their rectum, bleeding from their esophagus, bleeding, because alcoholics have the highest risk of bleeding. And then the other thing is 1 in 6 hospital admissions are an alcoholic. So yeah, it's highly likely they're going to be bleeding. Now, let's go a little deeper. Let's say that the bleeding is not the reason for the tachycardia. Let's instead say that it's hypovolemia, right? Volume. Volume of what, girl? Volume of fluid in the body. No, we did blood already. We're now on fluid. Well, who is that? Well, it could be the post-op patient as well, because it could be that because blood loss is part of every surgery and replacement may not be as much as we needed, that the patient is just behind in their fluids, and so they're a little tachycardic. In fact, it's been my experience that almost every post-op patient is a little tachycardic. What happens then? Well, IV fluids usually help. Maybe the patient is low on their fluids because they just had dialysis. Maybe the patient is low on their fluids because it's hot as hell outside and they work in construction and they weren't really replacing the fluids, and so they're very low in their fluids. Maybe the tachycardia has nothing to do with blood or fluids. No dehydration, no hemorrhaging, no hypovolemia post-op, none of that. Maybe the patient is tachycardic because they're anxious. You and I both know that depending on what's going on with anyone, anxiety comes with a lot of our patients. Anxiety, fear of what's happening, this feeling of doom, this non-stop panic attack in some patients. Those can all cause tachycardia. Okay, well fine, maybe it's not blood, maybe it's not fluid, no panicking involved. Then what else could it be? Well, it could be me, little old me. Yeah, me. What's me? Me is hyperthyroid. Can't you tell? I'm a little hyper. Yes, honey. Yes, indeed. And that's on drugs, honey, because I'm well controlled. But I'm still a little hyper. Just saying. I'm probably more likely closer to 90 than I am closer to 60 on a heart rate. But if it's uncontrolled and this patient has hyperthyroid, then the word Graves ought to come to mind, because Graves' disease or hyperthyroid can be very tachycardic easily. Okay, well maybe it's not that. Maybe it's not anxiety, it's not Graves' disease, it has nothing to do with hemorrhaging, the patient is not hypovolemic, maybe it's actually an infection. An infection / fever and chills. So you better be checking that patient's temperature, making sure that it's not a fever. And I will tell you this, patients that get a rapidly increasing fever and you're worried about sepsis, they very often will have chills as a sign of a rapidly increasing temperature. So be careful when the patient says they're really cold and it's really hot to all of us. Check their temperature, because it could be that fever / infection that is causing this. Lastly, It could be lack of oxygen. You see, your body's trying to compensate. Maybe they're hypoxic. Maybe you need to put that pulse ox on. You find out that they're freaking riding in the 70s and the 80s. Well, what's the heart rate to do? It's going to increase to get more blood to tissue, because there's certainly no oxygen going to tissue, and blood is oxygen. So if I go really fast, I can get blood and oxygen to tissue. Now listen. This was not an exclusive list, but it was the list that you needed. It was the list that your behind better remember for that test. Select all that apply. See you in a minute.